Folks, this is Rick Steitner. I'm with Coastal Hearing Center. I'm the audiologist here at Coastal, and it's kind of a new world that we get a chance to talk to each other this way. The topic for today really has to go over some new things that we have come up with at Coastal Hearing Center. You know, in 40 years of seeing patients, I think the three things that patients have always said to me is, how can I have access to the newest and most current technology, number one. And number two, I'm always concerned about price and finances and how to take care of my the cost of doing something. And third, the follow-up service. And when I would talk to patients about that over the years, you know, technology was rather slow in developing, so we didn't have the opportunity of new and exciting technology the way that we have today. Service has always been very important for our work with patients here at Coastal Hearing Center. So it's kind of been in our bloodstream to help patients short term and long term. And then finally, the finance aspect of it. Many times, insurance companies, Medicare does not provide financing for hearing aids. And so that's been a stumbling block for a lot of our patients. But we're really excited about a new program that we came up with, and I always like to read these things. It's called our Comprehensive Hearing Treatment Plan. And I'm going to read something to you that I think is real important, because we look at this as a journey. We look at working with our patients as not just one visit or two visits, but really the lifetime of your hearing and hearing loss. And so with our Comprehensive Hearing Treatment Program, we have an extensive hearing rehabilitation process. And what that means is that when a patient has a hearing loss, it doesn't just stay stagnant through their entire life. And things change with their hearing. Hearing may get a little bit worse, or their environments that they're in may change. And so we have to work closely with the patient, whatever we're doing, to help them kind of maneuver through those different hearing environments. And that's our rehabilitation program. We want to see a patient on a regular basis, because anything that we put on our body, even my glasses, you know, of course, my office always teases me. There's always something that goes wrong with my glasses. But hearing aids are something you put on your ears, and it's part of your body, and it's affected by the environment and things that you get in the rain and all those kinds of things. So we want to look at it and make sure that it's working. So we look at it quarterly. We provide an annual hearing test with this comprehensive treatment program. And the whole idea is that hearing does change. You know, people come into me for their first visit and say, hey, I have a hearing loss. How bad is my hearing going to be? Well, if I had a crystal ball, I could predict it. But after doing this for 40 years, I can see that a lot of people's hearing does change in time. Yet a patient doesn't know how much. And so what we try to do is follow all of our patients at least once a year with a hearing test. We also have, in part of this program, a 48-month repair warranty. And that means that all the things that might go wrong with the hearing aid are taken care of for 4 years. And that's impressive, because not too many things in our world, when it comes to technology, has a 4-year warranty. You know, they want to always sell you an extended warranty program when you go buy something. Most of the time, it's only 90 days. But now with our comprehensive hearing treatment program, we have a warranty that's covered for 48 months. If your hearing aid does need to go in for repair, we have a loaner set of hearing aids that are current technology that we provide you, because we believe that every day of your life is important. And so if your hearing aids need to go in for repair or a checkup, we've got hearing aids to cover you that will be appropriate for you while your hearing aids are being serviced. Also, which is real interesting, and I've noticed this a lot, because I've been seeing patients for 40 years. Most of my patients nowadays are using some sort of a mask. And patients are complaining sometimes when they have to put on their mask or take it off that it may affect the hearing aid. We've had a few patients that have lost their hearing aids because of these masks. Generally, throughout the lifetime of our hearing aid use, loss is rare, but sometimes it happens. What's really neat about our comprehensive treatment plan is that, in fact, if you lose your hearing aid, we can replace it with a small little deductible replacement cost not the price of a new hearing aid, but you get a brand new hearing aid to replace that. And finally, if you have batteries, because we have hearing aids that have rechargeables and then those that are disposable batteries, but during the life of this program, you have all the batteries that you need, and we'll send those to you on a regular basis. So back to what I said earlier, something that's always been communicated to me by our patients is they want current technology, they want a simple way to finance and pay for the hearing aids, and most importantly, how am I going to be serviced? And so that's why we came up with this comprehensive treatment program. We have had numerous patients take this program out over the last several months, and I can tell you with 100% confidence that all of them have really enjoyed a simple way to get excellent technology with the service they need without really writing a big check all at once. And I would encourage you, anybody that has a hearing loss, don't let the unknown be a fear for you. Don't let misconceptions stop you from coming in. Get a hearing test. Come visit us. Come see us. If a hearing aid is appropriate, this comprehensive treatment program makes it so simple, so cost effective, and exciting, because during the process of this comprehensive treatment program, when it's time to look at new technology, we automatically upgrade you to the best and most current technology. So I'm here right now, kind of live and in person. So if you have questions, I'm going to take a look and see if anybody's online right now to ask me a question. I did just see that I have one question about what happens if my hearing changes under this comprehensive treatment program. And it does change. Sometimes people don't realize it, but that's why we look at somebody's hearing year after year after year. And I'll see it when I've had patients over the years that all of a sudden they'll say, gee, my hearing aid isn't working the way it did, or a spouse may say it's not working the way it did when I first got the hearing aid. And as an audiologist, my first inkling is maybe the hearing's changed. So we'll go do a hearing test, and lo and behold, it has. Maybe not significantly, but just enough for us to pay attention to it. Well, with this new technology, what's so exciting is I can do a new hearing test, put the person back on with the hearing aids, reprogram it using my computer, and refit that same hearing aid on that patient without them buying new hearing aids and getting what they need to do again, and send them on their way. So that the way this new technology is, not only is it Bluetooth compatible with phones and Bluetooth compatible with TVs, and that the hearing aids communicate with each other and are much better at handling speech and noise and issues with clarity, but it also grows with the patient. And that's where the treatment program is so important, because as I see you, every time we ask questions, is your hearing changed? How's the hearing aid working? And what we find is after this type of program is implemented, our patient success and use with the hearing aids go through the roof. I think I might have another question here. Patient said, how much money down? This is what's exciting. Really, it's $189. So if you get the program, you put $189, your first month payment, and off you go. So that really makes it affordable, and that's the payment program that you have in time. But people will say to me initially about payment and concern, but what I find out is once somebody is fit appropriately and that they use the hearing aid for a week or two, all of a sudden the cost becomes inconsequential because their life changes. I had a fellow in this morning that got his hearing aids just 2 weeks ago, and his wife came in with them, and her comment was, you saved our marriage. I'm not necessarily a marriage counselor, but she said, it was very frustrating. We've been together for 50 years, but the last 5 years have been frustrating because we don't have the communication that we used to have. We don't share those little fun jokes that we have with each other, or when we're in the car or at a restaurant or what have you. But now that he has the new hearing aids on and he can hear me, it's like we're dating again, and it's like we're back to where we used to be. And when I hear that as a professional, it makes me feel very, very good that we've been able to help somebody regain that intimacy, that relationship, because that's what communication is. That's what hearing really is. It's the bond that we have with each other, whether it's with me and my granddaughters, which I have three, or me and my significant other, or me and my staff, or you and your grandchildren, whether it be over the phone or nowadays through the internet. That's how we stay connected. And when that's broken, when that chain, when that link is broken, we begin to be isolated. So with the comprehensive treatment program, it's I hate to use an analogy, but remember the old commercials with Allstate? They used to say, "You're in good hands." It's many ways that's how I feel with our patients. We've kind of put an umbrella or a blanket around our patients and provided an appropriate financing program, an excellent follow-up program, and the latest technology. I can only relate to another gentleman that I fit today. He said, "Boy, I don't know. I just don't think I could hear very well." And I said, "Well, give me a chance. Let me try something." And his son was with him, and his son was really frustrated because his dad moved down from the Northeast to live with him. And he says, "My dad and I just don't communicate the way I want to, because he's got the TV through the roof. Everybody can hear it. I don't want to be in the room." And you could see the dad wanted to try something, but he was skeptical. Put a very good technology on this patient, and his eyes just lit up. He looked across the room to his son, and his son said, "Dad, can you hear me?" And his son presented him his voice in a normal level, and his dad could hear him. And they were so excited. They never dreamed that they could hear so well. And they jumped on the comprehensive treatment program, and we'll see them in a week, because I like to stay close to our patients, and we'll be able to adjust the technology and make sure it's just right. And we'll continue to do training, because we'll teach them in a week how to clean and repair and do some things at home to make sure that the hearing aids are working right. Then he has an Apple iPhone and he wants to use that. Well, we'll teach him how to do that. So we do it in baby steps, but we're attached at the hip, I guess is the best way to say it to our patients. We're always there for them, whether it's on the phone or the follow-up visit. So, if you're thinking about trying hearing aids, think about Coastal Hearing Center. Think about our wonderful comprehensive treatment program that really covers you from A to Z. So if there's any other questions out there, I know I've had a couple that I answered in kind of the way that that I was presenting this, but feel free to ask them. If not, give us a call. We're at 843-979-3888. Ask for Rick. I'm the audiologist. I've got a great staff that works with me. I've been doing this for 40 years. I know I'm only 27 years old, so it's amazing, isn't it, that I've been doing it that long. So once again, thanks for taking the time, listening to me. Do give us a call. Love to help you out, or a family member, and we can go from there. All right, folks, take care now. Bye-bye.